Hi, my name is Colton Turner. I'm the first pediatric Crohn's patient to be registered to use cannabis in the United States. And this is my story.
I can remember it so vividly. Coltyn deteriorated so fast. All of these side effects that you can get from these medications, Coltyn was getting.
Azicol, Remicade, methotrexate, a long list of things. I can't remember them all.
It was making him sicker.
He was in a wheelchair. He couldn't stand up for more than a minute or two at a time.
We were losing him, and we didn't know what to do.
I was diagnosed in 2011 after drowning in a Boy Scout camp lake. It turns out the bacteria in the water triggered my once dormant Crohn's disease. It wasn't affecting me, but after my drowning, I got sick and I never got better. So we went up to Rochester, Minnesota to the Mayo Clinic, where we got a full diagnosis of Crohn's disease.
It was miserable. I was losing weight, I was growing weaker, I was constantly in pain. The only places I was at during the day was my bed, the couch, or the bathroom, and that's it. I would never leave the house.
And after that, it was just pharmaceutical after pharmaceutical, most of which did way more harm than good.
There wasn't one medication that Coltyn took that he didn't have a side effect to.
Remicade, which actually gave me rheumatoid arthritis and lupus. Prednisone deteriorated the bone in my heel, gave me a puffy face, and I had to wear a boot for 3 months. Methotrexate gave me a nosebleed that lasted 15 minutes long. And Humira, the last pharmaceutical I was on, it had swollen my lymph nodes to the size of golf balls, and the doctors were afraid that it was tuberculosis or T-cell lymphoma because these were some of the side effects.
So after Humira, we were faced with 3 options. Now at this point, before I get into the 3 options, I was 4 means behind in growth and in complete failure to thrive. I had 22 centimeters of inflamed bowel with skip lesions, with ulcers, inflammation, scar tissue, you name it, it was in there. And it was to the point where I wasn't absorbing nutrients right, so I wasn't growing. I didn't have any energy, I had constant fatigue, but I also had intense insomnia, so I was always tired but could never sleep. And I was in constant pain, constantly in the bathroom, not being able to do anything, really. And it got to the point where I was confined to a wheelchair. I was so weak and debilitating that I couldn't go anywhere without it. So at that point, the doctors gave us 3 options because they didn't think that there was anything else that they could do. There was a pharmaceutical that I could go on, which was called Cimzia, which after doing my research, I discovered that if I was an adolescent male, which I was, and if I had been on both Humira and Remicade, which I was, it would increase my chances of developing T-cell lymphoma by 66%. So that obviously wasn't an option. My second option was surgery. They would remove the 22 centimeters of inflamed bowel with skip lesions, as well as an inch on each side, in order to try and surgically remove the Crohn's disease. Now, the problem with this is that I would lose a very large part of my intestines. I would have a colostomy bag on my side for the rest of my life. It may not work, and even if it does, the Crohn's disease can come back. The third option was alternative treatments. Now, we didn't know what that meant. We didn't know what that would entail. But as we were getting ready to leave, and as the nurse was walking out of the room, he turned over to us and said, "You should probably check out what's going on in Colorado." And that was our green light. So in 2014, after 3 years of pharmaceutical treatment, me and my dad packed a suitcase full of clothes and a handful of cash, and we left for Colorado because Colorado had just legalized recreational cannabis.
Well, when we decided to try the cannabis, we really didn't know where we were going to get it from. We had to drive about an hour north to Denver just to find a dispensary, but the only one that we could find was in the most ghetto environment that you can think of. I couldn't go into the dispensary because it was 18 and up, and I was 14. And my dad said, all right, he locked the doors and said, here's the keys. If something happens, set off the alarm. So I said, okay. So I'm sitting there for like 35 minutes, just sitting there waiting for my dad to come out of this dispensary. The only thing they can get was the flour. And we had no idea what to do with it. We thought that we could go in there and get the sort of oil tincture that everyone was doing. We could not do that. So we thought, what are we supposed to do? Well, they make brownies with this stuff, so let's do that. We were living in hotels at the time, but luckily the hotel room that we were staying in, right outside the window was the roof of the pool. So my dad bought a bunch of stoves, a bunch of strainers and everything. He set the pot out there and he's making the pot brownies while leaning out the window. I'm on the inside putting towels along the door hinges and I'm spraying Febreze everywhere. We didn't know how to do dosing. So my dad said, well, I'll eat one and then I'll see how it affects me and then I'll kind of divide it out as, I see fit.
And then after a little while, we started using CBD oil along with THC oil. And then after that, we were able to put CBD and THC into one oil, and we dosed it out. We figured out that I actually needed an equal amount of CBD to THC, so I take a 1-to-1.
Before we left Colorado, we had a colonoscopy that showed inflammation, ulcers, you name it, it was in there. And we knew that the cannabis may have affected it somehow. So after calling about 8 doctors, the last one said, we'll take him, but if we don't feel that the cannabis is working and we tell you to go on another pharmaceutical and you say no, we will call Child Protective Services against you and we will take your child away. So we said, okay, well, bring it on, because we knew that it was helping. So we had this colonoscopy and the doctor walks in and it's clear. I achieved complete clinical remission from the cannabis alone.
So I made a little commercial. It was a parody of the This Is Your Brain on Drugs commercial.
Hi, my name is Coltyn Turner. I'm 14 years old and I have Crohn's disease. This was my colon. This is cannabis. This is my colon with cannabis. Any questions?
Lots of people started to see that video and thought, well, if he can get into remission from Crohn's disease using cannabis, then maybe I can too. And slowly, over time, more and more people started to use cannabis for their Crohn's disease with success. And it's been an incredible journey. So many people have been benefited because of cannabis, just for Crohn's disease alone.
There is new research on the use of marijuana as medicine in Colorado. A marijuana and health symposium at National Jewish Health explored nearly a dozen studies looking at using pot for things like seizures and insomnia. CBS 4's Mark Taylor reports.
For Coltyn, who's gone from hospital beds to Colorado mountaintops, his family hopes this research leads to action, which will allow families like them to have cannabis oil as a first option rather than a last resort.
We want people to understand that this is a good option. If we would have been able to give him cannabis when he first got diagnosed, we would have never had this tuberculosis scare. We would have never had the T-cell lymphoma scare. He would have had a childhood, and that was taken away from him by pharmaceutical medications. We didn't want to be quiet about this. We knew that Coltyn was the first pediatric patient to use cannabis for Crohn's disease, and we wanted to make sure that everybody else knew that this was a viable option, and it didn't have the side effects that the other ones did.
A parent has the right to treat a child that's suffering.
We used a Schedule I drug to put our child in remission. Everybody should have that option.
I would rather be illegally alive than legally dead.
And my journey doesn't end here. I'm still using cannabis, and I'm still fighting for the rights of patients. And I'm not going to stop until cannabis is 100% accessible to everybody on the planet. So hemp can be used for textiles and biofuels. And so cannabis can be a first option for patients and not a last resort. My name is Coltyn Turner, and for the past 7 years, I have been illegally alive.